This is the DocNation podcast. We are a movement founded by doctors, for doctors, dedicated to empowering medical professionals to reclaim control over healthcare decisions and advocating for their fair share of the industry's resources. Please note, the views expressed are those of DocNation and not necessarily those of our guests or referenced health centers.
Nice to meet you, Michael.
Thank you.
Appreciate your time. We used to do webinars that were about an hour. And
Yes.
so we decided to start by switch over to podcasts and do 15 to 20 minutes. So that's what we'll keep it at.
Okay.
But we really appreciate your time today. And thank you for giving back. And thank you for seeing a need and filling it. Healthcare is in shambles right now.
Yeah.
The insurance companies are thieves, liars, and stealers. And that's the truth. That might sound aggressive, but that's the truth.
That's true.
And Michael, you could just, ride off into the sunset and not be trying to. What you're doing is giving back, and we just appreciate that. And we're thankful for 15 to 20 minutes on our show today. And so, without further ado, would you mind introducing yourself?
Okay. My name is Michael Gomez. I'm the medical director of the neonatal intensive care unit at Winnie Palmer Hospital for Women and Babies, part of Orlando Health in Orlando, Florida. I also work for Pediatrics Medical Group. So we're a women's and children's based pediatric specialty group, takes care of newborns in intensive care, other things for the practice. But what we're talking about today is more my opinion about how things work in healthcare. I know people have lots of strong feelings about private practice, employed physicians, contract physicians like us, a lot of different things. But my opinion is, since I've worked in almost every venue, I've been employed, I've owned my own practice, and I've worked in academic health centers. I do see the differences and understand all of the nuances of healthcare that are out there. So, yeah.
So that's nice, Michael. You come to us with a unique view that almost none of our clients or followers have. So you've covered all the bases, and so everything that you say today is going to be speaking from experience, and that's always appreciated by any listener.
Yeah. And the experience is hard. You learn the hard way who to trust and who not to trust, whether it's insurance companies or even your employer sometimes, or your partners in a private practice can also be difficult as well. So there's a number of different challenges that are out there. But it was interesting. My first exposure to leadership in medicine was coming right out of fellowship. I was in Houston, and I was setting up a new program, and the hospital, I think to get rid of me, said, well, give us a business plan. And I was like, okay, a business plan for the program. And they said, yeah. And I said, well, I thought that's what you did. And they said, yeah, but we want you to give it to us. So I happen to have a sister who's an accountant, and she was setting up a new business at the time. And I asked her, how do you write a business plan? And she goes, well, you can look it up in books. And she said, but the most succinct finding that I can give you is actually, if you go to the old, remember we used to get old yellow and white pages delivered to our front door. If you open it up, the Southwestern Bell had a one-page description on how to create a business plan.
Okay.
So,
wow.
What was the name of that phone book company?
Southwestern Bell. Southwestern Bell was one of the old, before the divestiture of all the phone companies.
Yeah.
Southwestern Bell was one of them. There was Bell South and all sorts of different bells that were out there. I think these were all called the baby bells at the time.
Reed,
hey, that's so cool.
Reed, you're giving away your age.
Yeah.
That's so cool that the phone books were that like robust that they had a business plan leadership page or one pager. I wrote it down because I want to see what it looks like.
Yeah, so I'll see if I can go back and find it, because my sister still kept a copy of hers, because that's how she set up her trucking business with her husband. But anyway, so I came back to the hospital with a business plan, and they're like, oh, okay, well, I don't think they expected that I would figure that out. I think they said, well, here, we don't really see the value in the program, but we'll let you do it. We'll entertain you. And it was part of my recruitment agreement that I could set this program up. And so I presented the business plan, and then the next course curve that they throw you is staffing and all this other stuff that you need. And so we had our first planning meeting, and it was really complicated. And I remember sitting there in the room thinking, where did they learn all this stuff from? I mean, this knowledge has to come from somewhere. It didn't just arise out of thin air. Right. And so we started talking about where people got their degrees and their training. I'm a structured learner. I like learning that way, where people can present concepts and I can build on basic concepts and kind of improve my knowledge over time. So eventually got to the point where I realized I had to go back and get a degree in healthcare administration to understand how hospitals work, which was also a big eye-opener, because you realize that as physicians, we have so little knowledge about the entire system. We're kind of pushed over into one little corner, and we're told by hospitals and any sort of leadership position is, you take care of the medicine and we'll take care of the business. Well, that implies that you trust them to do that.
That's right.
Exactly.
And you may not. And you learn the hard way to who to trust and who not to trust. But that learning process, that 3 years in graduate school, really taught me a lot about how administrators think, how hospitals run, and then just the experience of interacting with them. Some I've had great relationships with, and others have been horrible places to work. And so one thing that I realized is if you're really solid on what you know and what value you bring to an organization as far as your medical care, you can choose where you want to work. You don't have to let the system pick you. You pick them and decide, does this program match my values, my principles? Is this a place I can work? If I say something, am I treated fairly? If I don't say something, am I still treated fairly? And then how is my work valued in the organization, and what kind of opinion do I have? And if you find out the answer to a lot of that is no and nothing, then it's probably not the right organization. You have to have the guts to be able to pick up your toys and leave. Yeah. That's hard for some people because they're very vested in where they're living. I was fortunate to have a wife and family that understood that work satisfaction was an important part of my identity. And so when I said it's time to pick up and go somewhere else, they supported that. And so, we kind of moved along till we found the right set of circumstances where you can thrive. And sometimes you find 50%, sometimes you find 75. Occasionally you'll hit a home run and find an organization that just says, this is a place that I can really be successful at. And that's where you want to land. And that's where you bringing that knowledge base and everything really helps make you successful in that organization.
Michael, it's awesome to hear that your family and you are such a team, because about 65% of our clients are telling their kids, you're not going into healthcare. You're not going to become a physician.
Well, neither of my kids went into healthcare. I have two boys. One is he does linguistics and language modeling and Spanish and a bunch of other things.
Cool.
He's traveled all over the world. Has a couple of MBAs. Struggles, he has to put his work together in pieces, and he kind of lives on his wits. So I'm very proud of what he's done. It's a tough life to live that way. The other one was became a healthcare engineer and works in startups and things. Okay. So both have an appreciation of what medicine can do. My son that's into linguistics is actually teaching me more in nuanced Spanish right currently. Okay. So working on Spanish language development, because my Spanish, even though I come from a Hispanic background, my family didn't speak a lot of Spanish professionally at home. So we're working on that. But all of them have an appreciation for what medicine can do, but neither one really loved the lifestyle. They saw the work and they saw the effort and the frustrations and things, and said, I think I'll do something else. More in control of my life.
That's right. Yeah. More in control of my life. And that's just a sad part of medicine, is that, the highest educated group of people in the country don't have control of their life.
Yeah.
It just seems really, really backwards to me. You've become such a professional, but the respect level of providing your work has been taken over by business people.
Yes.
That's sad. That's really sad.
Michael, did you recommend to your kids to get into medicine, or did you not really say anything to them?
I didn't say anything to them. I have some friends that were very adamant that their kids become physicians, very adamant. But I just let mine kind of pursue their passions and let them do what they want. my wife and I started medical school together, actually. She decided in her third year of medical school that it wasn't for her. And and just, you know, went and did a bunch of other things, a little bit of healthcare, but a bunch of other things, and then raised two great kids and had to deal with me. But so, you know, we at least had a common background and understanding of where we're coming from. It's really hard to tell your kids to do something that's that difficult to do unless they're really passionate about it. If I had seen passion from them, if I had, you know, if they wanted to follow me to work, if they wanted to understand what I would have asked them to pursue it, but I didn't really see. I saw other things that they liked better.
Sure.
And that's what I encourage them to do.
It's good intuition on your part for your family.
Yes. Dr. Gomez, thank you for being here. You sound happy.
Yeah.
And that's a great thing. I know DocNation, we try to help doctors negotiate, have a voice where they are. Like DocNation will even help doctors relocate their families, start practices and things like that. But how many stops did you have to really find that happy place?
Well, I think I've been happy in a couple of different places. There's other circumstances that sometimes take you away from fairly good jobs. I think this one in particular was more of somebody recognized that I was a good fit for it. About 5 years ago, somebody came to me and said, I have a program that I think you would really do well in. So sometimes people have your best interest in mind, especially if you work successfully with people before. They remember how they felt working with you, and then they say, well, you should come work with my organization.
Was that another doctor?
I'm sorry?
Was that another doctor that suggested?
Yeah, that was another physician who actually encouraged me to move over like that. But I probably made, I don't know, my wife says I change jobs all the time. That's not quite true. It's about every 5 to 7 years that I change. I think the longest position I've ever stayed in has been 12, and the shortest has been 1. And again, it's that intuition that I don't fit here, I fit here. I should stay here. A lot of times things are going really well, and then there's an administrative change in your organization. And then you realize no matter how hard I work, I'm not going to be able to get this direction back where I want to go. And then it's time to step out. And I think having that ability to, or the confidence in yourself to be able to say no and walk away from a job is as hard as anything else that you have to do. Because you know you're uprooting your family, you're leaving people who you work well with in some cases, and you're leaving for very personal reasons that are sometimes hard to express to people. But you just know it's time to go. So you know, I think the job before this one, I remember the person who hired me was not actually my boss when I got there. Something had changed in the organization. I think there were some illnesses involved and some other things. But anyway, the person who liked me and hired me was not the one who I ended up working for. So the one I ended up working for kept telling me, well, I really don't know what to do with you. Write me a job description. Well, right away, the alarm bells started going off. And
that's a red flag.
Even though after 3 years, we were making some progress, I remember this one email I got, and he asked me for a report, basically that was kind of, I think he described it as a weather report. I think what he meant was taking the temperature of the room. But when I realized how far we were moving apart from each other, I said, I really thought weather, like storms and clouds and things like that. And so after the meeting, after we met, he said, this isn't what I was looking for at all. And I said, well, I don't think I understood you. And that was the biggest clue to me, because my annual evaluation was coming up at the same time. And I said, why don't we go ahead and do my annual evaluation right now as well? Because I think it's time for me to leave. And what he asked me was, well, what are you going to do with yourself? Because I kind of moved into an administrative job. And I said, well, I'm still a good clinical neonatologist. I'm really lucky to have that good, sound clinical ability to go back to a job and do that. So he was a little bit worried that I had stepped out into administration and couldn't go back to clinical practice. I wasn't worried about that at all. Yeah. But one, I realized that because our thought processes had moved so far apart from each other, this was not the right job for me anymore. And secondly, that even if I told him after the evaluation it was time for me to leave, because the evaluation really wasn't that bad, that I knew I could land on my feet. And so I think as physicians, the reasons that you can land on your feet is because you're a good clinician. I think I spent years trying to understand complex healthcare systems and finance, and I don't think that I can be taken advantage of in any way without just picking up my stuff and walking away. So, I'm fortunate in that sense that I'm able to do that. I know everybody's not in that position. A lot of people say, I can't leave. My family's here. My, everything I have is committed to this one place, and this is where I'm going to stay. So they'll take all the grief that comes with the job to stay in a particular place.
Yeah.
So you were quoted in a recent publication about loss of control being a major factor of the problems facing physicians. And you've talked a little bit about administration changes, things that are happening behind the scenes that may or may not have anything to do with you seeing patients. Would you say that's kind of the core area that you find is the driving factor for maybe what you and your colleagues would say is not the right environment as it used to be? Or could you speak to that a little bit?
Yeah, I think as physicians, we don't understand anymore what our employers are looking for from us. They talk about so many different things. They talk about profitability. They talk about access to patient care. They talk about high quality patient, but they never really define what that means, nor how can I achieve that? What do you want me to do? Is it more RVUs? Is it more office visits per day? Is it more admissions in the hospital? What exactly is it? Well, just more of what? And so you're often, the direction from your administration of, it comes up at this level, but by the time it pushes down through the operational levels of the organization, hospital, for example, the administrator that's assigned to you may not have any clue about what's in between. They just know that their job is to, you had 30,000 RVUs this year, I need 35,000.
Yeah.
And so those types of things don't resonate with us. We don't understand what that means. And it makes it really hard, because what the top level of the organization's thinking and speaking doesn't match what the middle is speaking and thinking, and doesn't match what gets reflected to the physicians to actually have to execute on. Yeah, makes it really hard.
Well, when they look at you as if you're the profit source, you're the source where they can extract as much profit as possible.
Yes.
They want you to produce.
Yes.
Produce. You are the workhorse that they want to just exploit you as far as they possibly can. And maybe they're not intentionally trying to hurt you or other doctors, but like they're trying to squeeze the juice out of a fruit that's been squeezed out. There's nothing left. Like you can't. And that's why DocNation is not just about helping doctors get their voice back. It's also about patients. Like at the end of the day, who is going to benefit the most by doctors being back in control? It's the patient.
Right.
We had another guest on not too long ago, and he was saying, and you've probably heard this might be just standard education back in the day, but if you talk to your patient long enough, the diagnosis will come off their lips.
Yes.
They'll tell you what the diagnosis is.
Yeah.
There's no time for that anymore.
No.
If they want, they got to ram patients through as fast as possible, because cha-ching, ka-ching, ka-ching, like that's not good for patients.
Right.
It's not good for doctors.
Right. And that's why I think it's really important to understand the environment that you're working in, and does it match your values and principles? And if it doesn't, then I don't know. To me, you have to be able to pick up and go somewhere that really aligns with what you're doing. Does the organization motivate me? Do I feel empowered when I go to work? Does my voice matter? All those types of things are really important, and you just lose that over time. It's really easy to get lost in all of that, and overwhelmed too, because again, if you don't have the background, if you've never heard this stuff before, it's really hard to understand. And that's what motivated me to go back to school 20 years ago almost to pursue degrees and to really try to understand, well, what are these words? Why do they keep using these things, and where did they learn them? It's interesting. I find it fascinating that nurses and hospital employees, like lab employees and physical therapists, they all seem to learn it somewhere along the way, because they're given tasks within the hospital where they're measured and compared to other parts of the hospital, but we never really are. We're always kept in one corner. And I don't know whether it's a deliberate lack of sharing information with us, or it just isn't in the cards to be shared with us. But it's really important to understand what you're dealing with when you go into an organization. So yeah, I spend a lot of time doing that, trying to understand what motivates them and can I trust them. So
I don't see a really good reason why you wouldn't want to share this information with the doctors.
No, well, like anything else, I mean, information is power. It really does. If you have all the information, what do you need other people for? And so I think that's one of the big issues, is where people use that knowledge, they hoard the knowledge a bit in order to protect their position, and it makes them relevant. And if physicians don't have that information, then they're relatively irrelevant, and you can control them more easily. So I agree with you. There's not a reason not to control, not to share the information, but it's just a common thing that I see people do.
Hoarding information to protect their position. That's interesting.
Yeah.
It feels like the communication, Justin, should almost be when you have these systems that don't meet the values of our physicians, that should not only be communicated to other physicians, but also patients.
It's a huge disconnect.
Yeah, no, it is a huge disconnect. And I think that, again, you begin to appreciate the organizations that do it well, because there is a lot of communication. There is a lot of data sharing. Obviously, they're not going to put spreadsheets and things in front of you with tremendous numbers of details, but they'll put enough information in front of you to make rational decisions. And I think that's what physicians need more than anything else. But you also have to understand the information as well. So, I've always worked in a group practice, and you do need the collective. That's one thing that physicians do need to work together. There isn't always that togetherness. I keep telling my group, of everyone in the organization that you need to love each other, you should love each other first. And they kind of laugh at, what do you mean love each other? I was like, well, you don't have to like each other, but from a practice standpoint, you have to have each other's back. You have to be able to work with each other, understand the strengths and the weaknesses. A team of like us, 25 physicians, we don't have 25 quarterbacks. We have one or two, right? We have one or two that lead. We have others that are good blockers. We have others that are good runners. Everybody's got their role, and everybody plays their role well. But if we had 25 quarterbacks, we wouldn't be any good. We really want people in the right roles. And that's the value of the collective in medicine, especially among physicians, is to understand how to put the right team together as well.
Have each other's backs, collective voice. This is why we exist. It's why we're here. It's why we're talking.
Yes.
We need to unite the voice. Today's the first day of striking happening by the longshoremen. It's reported 45,000 workers are potentially going to shut down the ports, and they are united, and they want to have their voice heard. The doctor's voices could be the most powerful voice if it was just brought together. And so we appreciate you coming on with us to share your background, share the wisdom that you have. You've been through a lot of different phases of your career, and I feel like many can benefit from that. And I think having that perspective of having each other's backs is so key. So thanks for jumping on with us and sharing that with us, and we look forward to talking more in the future.
Okay, my pleasure. Thank you.
What a great legacy. Thank you, Michael.
You're welcome.
All right. Bye-bye.
Have a good day.
Thank you.
Bye.
This has been the DocNation podcast. If you like what you heard, be sure to subscribe, rate, and leave us a review on Apple Podcasts, Spotify, or wherever you are listening to us. Your feedback really helps us reach more listeners like you. We'd also love to hear your thoughts and any topics you'd like us to cover in future episodes. Don't forget to follow us on Facebook, Instagram, and LinkedIn for updates, behind-the-scenes content, and to join the conversation. Thanks for listening.